Ischemic stroke commonly causes cytotoxic cerebral edema because there's a lack of glucose and oxygen that goes to the brain cells. As a result, the sodium-calcium pump of the membrane of these glial cells become broken. So there is an excess amount of calcium and sodium ions inside these cells, which causes an uptake of water. This abnormal uptake of water inside these cells causes the right portion, in our case the right portion, of the brain to swell, which leads to the next point, that there will be an intracranial, increase in intracranial pressure, and a decrease in amount of blood flow that goes to the brain because the greater mass of brain will constrict the blood vessels. Greater mass, of course, will cause an increase in pressure because there will be a lack of space for that brain. The causes of cerebral edema include cancer, because as stated earlier, clots will decrease the amount of glucose and oxygen to the brain, and so cancer causes clots, so it can cause cerebral edema. Additionally, trauma can cause cerebral edema because it may put the blood-cerebrospinal fluid barrier at risk, as well as the blood-brain barrier, blood-brain barrier at risk, resulting in leakage. And lastly, infections such as encephalitis or meningitis may cause cerebral edema by the process of inflammation, and inflammation is commonly known to cause swelling. Other less common causes of cerebral edema include exposure to high altitudes without acclimatization, and altered metabolism in the brain cells, as well as blood plasma dilution. The symptoms of cerebral edema include disorientation and essentially a lack of cognition. So there's going to be there's going to be perception loss, there will be possible dementia, nausea, vomiting, and the possible treatments of cerebral edema include osmotic agents. Particularly mannitol is said to cause there to be a loss of fluid in the brain cells by causing the endothelial cells of the artery in the blood-brain barrier to shrink. It also causes that artery to become hyperosmotic to the cells, causing the brain to lose water and therefore causing it to lose the intracranial pressure. Hypertonic solutions have similar results. Additionally, the diuretics cause the body to force urine, and as a result, the fluids around the body in general will be lost, causing, again, the pressure in the cranial vault to decrease. And lastly, surgery in more severe cases can decrease pressure. For example, decompressive craniectomy is the process of removing parts of the skull and thereby decreasing the pressure inside the cranial vault. If you look at our cadaver, the probe is pointing to the right hemisphere of the brain, which makes sense because because we stated earlier that the right carotid artery is said to have an embolus, so the right hemisphere of the brain will not gain the necessary nutrients. The symptoms of cerebral edema are present in the right hemisphere because you can see that the gyri are flattened, the sulci are narrowed, the right ventricle has become compressed, and in general, the right hemisphere of the brain is smooth and soft. And you can see the swelling as well. You can see how the size of the right hemisphere is greater than that of the left hemisphere. If you move on to the next picture, you can see that the brainstem is asymmetrical. You can see that the right portion of the brainstem is even drooping a little bit, and it is perhaps more oblong than the left part. This contributed, in fact, to great difficulty in removing the brain and the brainstem from our cadaver during our neurological dissection.